Good afternoon, everyone who is joining us from all over the country, I hope. Thank you so much. I am Lisa Emmett, Executive Director of National Kidney Donation Organization. I'm also the only member of our team who has two kidneys. I do not like that makes me unique. I tried to donate for my husband in 2017, but I was ruled out due to a condition in my renal arteries. And this first Engage session is going to be a year-long series of webinars and Ask Me Anythings dedicated to anything living kidney donation and transplantation. This first one is helping your recipient find a kidney if you can't donate. And we are very grateful to Sanofi for sponsoring this. They are a global leader in immunology, and they are making these presentations possible. Just a few housekeeping notes quickly. Please keep your microphone muted and your camera off if you're not speaking. And there is the Zoom Q&A chat, the Q&A or the chat to ask questions. Terry will be helping us with questions later on. So briefly, NKDO was founded in 2016 by non-directed donor Ned Brooks, and it's the largest donor advocacy organization in the country. We are largely focused on living kidney donors and donor protections, but we know you can't be a donor without having a recipient. So it is if you cannot be a donor and you're wanting to help a loved one or a family member or a close friend, it is a very desperate and helpless feeling to know that you are 100% committed and willing to give a kidney for a loved one, but that you are medically ineligible to ever give one to anyone at all. It's a big problem. So what we hope is that this webinar will educate people in this same situation and empower them with hope, inspiration, and useful tools. My mantra is, you don't have to donate a kidney to make a difference. Today, I'm joined by Terry Thiede, Vice President of NKDO. She's also a non-directed living donor. She will monitor the chat and pose questions at the end of the webinar. We are also joined by a nephrologist who will discuss donor eligibility. And we have the good fortune of having two donor candidates who tried to donate for family members, but were also unable to do so, joining us. So our first panelist is Dr. Amanda Leon-Bergue, Medical Director of the Living Kidney Donor Program at Penn Transplant Institute. Dr. Leon-Bergue is a general nephrologist with over 8 years of experience caring for living kidney donors. She's passionate about providing exceptional patient-centered care in order to ensure safe and equitable access to living kidney donation for those with kidney failure. Dr. Leon-Bergue, thank you for joining us.
Good afternoon, and thank you to Lisa and the NKDO for the invitation. Today I'll be discussing the medical evaluation of the living kidney donor and what decisions we make to determine candidacy for living kidney donation. Before we begin, living kidney donation is considered ethically justified on the condition that donors undergo rigorous medical screening, assessment, and provide informed and voluntary consent after the education. Recall that living kidney donation is one of those rare instances in medicine that we consider a surgery that is medically not necessary for the individual undergoing the surgery. However, I recognize, as do you in this audience, that medical necessity isn't the only thing you're thinking about when you're coming forward to consider living kidney donation. You're considering the real and very tangible benefits that come from helping a person in need. Sometimes it's a family member, sometimes it's chosen family, a friend, or a coworker. And I do not want to diminish the tangible benefits the living kidney donation has when you care about someone living with kidney disease or kidney failure. Next slide. When I evaluate someone for living kidney donation, it is my responsibility to ensure that this is a safe endeavor for the living kidney donor. In this role, I think about three things. First and foremost, we are evaluating the donor health risks after kidney donation. And so this encompasses both short-term surgical risks and long-term lifetime risks following donation of a kidney. Goal number two, we need to ensure that the decision to consider living kidney donation is informed. Risks are informed and that this is under voluntary consent. And our third priority from a transplant center, we do wish to provide consistent and transparent decision-making in our process. So if you look at the computer graphic on the right-hand side of this slide, it walks you through how a transplant center makes decisions related to candidacy. Looking at the y-axis, you see projected lifetime risk of kidney failure. And on the x-axis, you see different candidates A, B, and C. The dotted horizontal line shows a cutoff for a risk threshold that is defined by each transplant center. So this cutoff risk threshold is unique to the transplant center you go to. Above this risk, a transplant program will decline the living donor candidate. The projected lifetime risk of kidney donation is made up of 3 categories. The first category is demographics, in blue. You can see age, sex, and genetics play a role in that. The next category of risk is an aggregate risk based on health characteristics. This is identified in orange. This is the risk of kidney failure without donation. What would your risk be of kidney problems in the future? And then the third risk category is the green category. This is the donor attributable risk, or when donating a kidney, what might that act of kidney donation do in terms of kidney failure risk in the future? You can see candidate C on the right-hand side of the computer screen is above the target threshold for a center, and therefore this is an absolute rule out for living donor candidacy. Candidates A and B are below the risk threshold, and therefore there is an individual choice. Recall point number 2, informed consent, where the individual is allowed to make certain decisions about unknown risks. And although I said that it is necessary for transplant centers to have transparency in their decision, it is true that different transplant centers define their upper limit of risk differently, which sometimes can lead to some ambiguity and frustration on the part of the person interested in donating, and also the person who's in need of a kidney transplant. Next slide, please. Now, although transplant centers will have different criteria for acceptance of living donors, there are some key absolute no's when considering living kidney donation. And these are based on the United Network for Organ Sharing Policy and Kidney Disease Clinical Practice Guidelines. First and foremost, you see age must be over 18 years. If you are able to vote, you are able to consider choices related to your overall health and wellness. The first row of the table describes the medical assessment for kidney health. So in order to be a kidney donor, you must have normal kidney structure and function. This is assessed by GFR, urine protein measurement, and imaging. Absolute rule-outs include evidence of chronic kidney disease, an anatomic abnormality, and a vascular abnormality or problem with the blood vessels to the kidneys. Going next to row number 2, cardiovascular health. In order to donate a kidney, you must have good cardiovascular health to ensure no short-term surgical risks or long-term complications related to heart disease. This is measured by blood pressure, blood work, including a lipid panel, medical history, and sometimes a stress test. Absolute rule-outs include uncontrolled hypertension, hypertension with organ damage, including kidney damage or heart damage, or the presence of cardiovascular disease. The next element of the medical assessment includes infectious disease risk. So infectious disease testing must occur for both donor safety and also recipient safety. And any active infection does prevent a donor from moving forward. In current state, you see HIV as an absolute rule-out unless approved under a clinical study protocol. The next medical assessment includes endocrine function or diabetes risk. Diabetes is the #1 cause of kidney failure in the United States, and so understandably, this is a risk that can change long-term kidney risks. The assessment for diabetes includes body mass index, a hemoglobin A1C, and sometimes an oral glucose tolerance test. Absolute rule-outs, which would indicate you cannot donate a kidney, include the presence of type 1 diabetes. And for most centers, type 2 diabetes is considered an absolute rule-out. But there are some caveats to this consideration. You see that body mass index is not listed as an absolute rule-out, but this is considered when we think about risks for the individual in the future. Next is an assessment of oncologic risk or cancer risk. Now, donating a kidney does not change your risk for cancer, but we need to consider cancer both for donor safety and also the risk of transmission for cancer to the recipient, and this is specific to melanoma. It is important to be up to date with your cancer screening. This is incumbent on the potential donor to be up to date on this cancer screening, and that's a requirement for all centers. Family history is also an important consideration as well. So preparation for questions about family history is important for the donor evaluation. Presence of cancer, incompletely treated cancer, or cancer that has a risk for transmission is considered an absolute rule out. The last assessment is donor well-being. So psychosocial assessment is conducted through interviews with a social worker and sometimes a psychiatrist. Questions including discussions about mental health, substance abuse, and motivations for kidney donation are discussed. Significant untreated mental illness is an absolute rule out for living donor candidacy. There are several other relative contraindications to donating a kidney, and sometimes these relative contraindications can be modified through discussion with your primary care physician and with the transplant donor team. Next slide, please. So even though someone is seemingly healthy from the outside, you can see that there are many reasons why someone may not be medically suitable for kidney donation. It does not diminish the decision you made to come forward to consider living kidney donation, nor does it diminish the time it took you to make this decision. Individuals who are evaluated for living kidney donation do receive perhaps the most comprehensive medical evaluation you'll ever receive. And unfortunately, we do find things that can pose risk to someone's health in the future. If you're given the news that you are medically ineligible for kidney donation, there are 3 steps that I recommend you take. Step number 1, talk with your primary care doctor about your evaluation. There may be things that are uncovered that do require additional medical attention. And so I recommend along the process, even at the time of evaluation, that you see a primary care provider. The living donor team is responsible for making a decision about the safety of donation, but it is your responsibility to talk with your doctor about abnormal findings. The next thing, I do want to make sure that you continue to work towards improvement for your overall health and wellness. There may be things that are uncovered that make you ineligible right now, but sometimes in the future, individuals can be reconsidered. And so continuing to work towards improvement in overall health is an important next step. The third step, most importantly, share your story about the living donor evaluation process. Talking about this and normalizing organ donation while living can help give someone else the motivation to move forward. And you'll hear some stories today from people who have done just that, shared their story, and you will see a tremendous impact that this can have for the person that you wish to help receive the gift of life. Thank you very much. Turning it back over to Lisa.
Dr. Leon Bergu, thank you so much for that excellent information. Now we turn our attention to Tammy. Tammy Mayer tried to donate for her son, and I'm just going to read a quick blurb about her. Persistence, patience, and prayers define Tammy's experience trying to help her son find a living kidney donor after she was told she wasn't medically eligible to donate. Today, her son is nearing his 2nd anniversary with his new kidney, and he feels great and very grateful. Tammy, we look forward to hearing your story.
Thanks, Lisa. So as Lisa said, my name is Tammy, and when our son Oliver was about 7 years old, we learned that his kidneys had never grown and that it was likely that he would need a kidney transplant someday in his future. And Oliver was about 20 years old when he was placed on the kidney transplant list. And although we had known that that day would someday come, my husband and I were still in a state of shock, as you can imagine, when we heard the news, and I'm sure you all can relate. Oliver was adopted, so we knew that it was a long shot that we'd be a match for him, but we did hope that at the very least one of us would be approved to donate as part of a swap or a paired exchange. And unfortunately, that didn't turn out as we had planned. Neither my husband nor I were medically approved to donate, and of course that was another unexpected blow in our thought process. I felt that at the time, I really felt that my faith was truly being tested, and yet I firmly believed that God would provide for Oliver in his perfect timing. So I placed my trust in God, and we were committed to doing everything in our power to help Ollie find his donor. So we focused on finding a living kidney donor because we knew that's what would be best for Ollie since he was so young. And Ollie focused on remaining as healthy as possible, eating properly, taking his medications, hydrating, getting proper rest, all that. Ollie was fortunate to have been granted a National Kidney Registry microsite, NKR microsite, by the Hospital of University of Pennsylvania. So after getting that set up, the first thing we did was to secure a vanity URL. We chose kidneyforoliver.com and we linked it to Oliver's NKR microsite. And that URL made it easy for people to remember the website address and also for us to advertise. Prior to all of this, I had never been on social media because I'm a very private person, but I really had to just let that go. And I enlisted the help of my sisters and dear friends who rallied around us and shared their creative and their um, techie expertise and talents with us. We began posting about Oliver's situation and also facts about kidney donation so that we could educate as many people as possible. I also emailed hundreds of friends and family asking them to forward the email far and wide. Oliver's NKR microsite was included in every email and social media post. And I prayed, asking God to give us wisdom and persistence in our search and patience in our wait. We organized a gathering of over 100 friends and family at a minor league baseball game. Each person was given a green t-shirt like the one that I'm wearing today, and we filled an entire section at the game. It was a sea of green t-shirt wearing fans who couldn't be missed and got lots of attention. The baseball park prearranged to have Ollie throw out the first pitch while they announced our plight on the jumbo screen and asked fans to go to his website. And I continued to pray and release my anxiety and stress to God. We created flyers and had many volunteers who graciously distributed them in their neighborhoods and retail parking lots. And I finally resorted to wearing a sandwich board sign and walked around our small town with it whenever I could. The sign simply said that our son needed a kidney, and of course, it included his website address. I also created a QR code and included it on my sign to make it easy for people to go straight to Ollie's microsite from their phones. Many people stopped to ask questions, and I handed each person a business card that we made that included Ollie's photo and website address. I also reached out to the local news stations and newspapers, and they picked up and published our story, showing me walking around town wearing the sandwich board sign. And my church family faithfully stood by us. The congregation regularly prayed together for us during church services. We truly have never felt so loved. And it turns out that a young man from our church congregation, whom we hardly knew, went through the donor evaluation process unbeknownst to us. One day after church service, he surprised me by telling me that he was approved and was going to donate his kidney to Oliver. God answered our prayers with a donor from our own church. It still shocks me every time I talk about it. And in January of 2023, Jeff donated his kidney to Ollie in God's perfect timing. As Lisa said, Ollie's doing great. His kidney seems to really like its new home, and we're glad about that. We're also very grateful to Jeff and his wife and their young son who sacrificed for us. We're also thankful to our family, friends, church who encouraged us, shared their skills and time and talents with us, prayed for us, and I can't imagine where we would be without the thousands of people who saw and heard our story and shared it far and wide. And of course, we were reliant on and grateful for the services and resources from NKR, NKDO, and the Hospital of the University of Pennsylvania. Most especially, we give our glory to God, whom all of these blessings come, and our family is truly blessed beyond measure. We hope that you too will be blessed in your endeavors to help your loved ones. No matter how young or old a person who needs a kidney is, I believe they need strong, persistent, and prayerful advocates who will do everything in their power to help them so that they can remain focused on staying as healthy as possible in their wait. I'll turn it back to you, Lisa.
Tammy, thanks so much for sharing. I wanted to remind everyone to put your questions in the Q&A, and we will have time for questions at the end. Also, if there are other strategies or suggestions that you have for people looking for a living donor, please feel free to add those in the chat and Q&A as well. Next, we're going to turn to Donna. Donna also was fighting for her son. Donna VO was medically disqualified from being her son's kidney donor, but she did not give up. With love and relentless determination, she made it her mission to reach out in all possible ways to find him a living kidney donor. Now they're celebrating 1 year with his new kidney. Donna?
Thank you, Lisa. Thank you, everyone. My name is Donna Vio, and our 25-year-old son, Greer Vio, received his kidney on September 14th, 2023. Back when he was about 21 years old, he went to his regular physical. They did some lab work, and fortunately, his general practitioner paid attention and thought his lab work was very unusual for somebody of Greer's age and reran it, sending him to a nephrologist, and they then sent him into Boston for biopsy, and he was diagnosed already in stage 3 of chronic kidney disease. They absolutely had no idea what the origin was. They suspected maybe he had some sort of a virus throughout his life that perhaps went undiagnosed. They really did not know, but they said they could probably control it with medication and just monitoring him, and that life went on. And it did. He graduated from college. He had a great job. He moved to Boston with his friends, and he felt good, and he was monitored and so forth. And then in January of 2023, his company had a massive layoff, and I said, get a physical. And he said, Mom, I'm seeing the doctor in March. I said, I don't care. Just get a physical now. Trust me, Greer. It's just good to do while you haven't things while you have the time. So he did, and unfortunately, he was already in end-stage renal failure, and he felt nothing. And within 3 weeks, he had an emergency hemo port put in and started going on hemodialysis at a clinic. And I went with him to all those visits, and he was being trained on peritoneal dialysis. And on Easter, he went into peritoneal dialysis, which is home dialysis. And it progressed from 8 hours a day till 13 hours nightly. He was hooked up to PD, and multiple visits into the hospital. And I immediately began the testing process. The Brigham is affiliated with the NKR. He got a microsite. I rewrote the microsite. It was launched within 3 hours, photographs and things detailing Greer's situation. And I became disqualified about 2 months into my testing due to a low GFR that was unacceptable. My husband is a diabetic, and our younger son is, excuse me, our younger son is was disqualified because they did not know why Greer had this, so they wanted to watch our younger son just in case. So I took over the social media aspect of it because Greer is not really into social media at all. So through the microsite page, I read the dashboard with the NKR, and they suggested ways to share on social media. My husband took the generic card that we were given, and he had these magnets made. We had them on our cars. We had 125 plus bumper stickers we gave out to family members and friends. We advertised on my Facebook page and on some multiple pages that I have different sites. Then I joined about a dozen Facebook groups in my town, neighboring towns, my hometown. My high school reunion dedicated it to him. We were in theater programs, the newspaper, local websites. My sister got us in a publication on the South Shore. My other sister-in-law got us in a publication on the South Shore as well, which we're originally from. We just went absolutely relentless. Every 3 days, I was posting a different post with pictures of Greer growing up, pictures of his life, connections to his QR code. We were in local news. Boston 25 came to Gloucester, and we were profiled on that as well. We had cards in stores, pictures of Greer everywhere, and he had over 4,000 views of his microsite page, and over 64 people come forward to begin the process. And in August, we were notified that he in fact had a donor. I was devastated when I wasn't available, but Greer was the consoling person to me, and the nurses on the team said this happens and just keep going forward. I was encouraged by my NKDO mentor, Lynn. So when we got the news there was a donor in late August on September 14th, um, we went to Brigham, and the surgeon said he couldn't have had a more perfect match. And he was doing great. He came back here, lost it great, and I had closed my studio to take care of him. And my husband and I loved. The only good thing about this was we got to have him live at home with us for 2 months, and I had a heart attack the second week in November. And when I got home from the heart attack, I opened my email, and Greer and my other son and my husband was sitting there, and it was the letter from the donor introducing herself. A beautiful mother from Maine. She had 3 children, a 20-year-old, 18-year-old, and 14-year-old, and a wonderful husband and family that completely supported her. And she was flying home on a plane after visiting her oldest son, feeling sad, and started scrolling through Facebook and saw my posts and saw Greer's picture. And she said she had felt what she calls a heart tug. And she knew in her heart and soul that she would be Greer's match, and she was. And she actually described how she was standing right beside us in the waiting area to go in, and did everything she could to keep from telling us, because uh, of course, we want everything to go smoothly for everyone. And she's doing beautifully. Greer is doing beautifully. He's finally back at work as a computer scientist. He's back at work living in Boston with his friends. He's healthy. He's doing well. The donor is doing beautifully. We can't thank everybody with the NKDO and the NKR and the Brigham and Women's Hospital in Boston, and all our family and friends and all the people who came out. The biggest thing I can say is be relentless, because there is somebody out there who, that's why there are these organizations, because there are these people coming forward. And regardless if you're not able to be the one, put that aside and do anything and everything you can to get that word out. And there will be a point of fatigue, we were told, that people will see your posts or see your message and say, yes, I saw that. I keep going, because it only takes one person, and that one person can spread the word, and it just is like a snowball effect. And I can't thank everybody enough, especially our beautiful staff at the Brigham, the surgeon, Dr. Tullius, who I talked to just 5 minutes before Greer went into surgery. And I practically tackled him when he came out of the surgery. And our beautiful Dana, our angel here on earth, and Lynn, and everybody. We're so, so grateful for our family and friends and all the people who don't even know us who came forward for Greer. And so it's a miracle, and it's our beautiful miracle. And I want to also quickly mention the outreach I received on social media from so many other people in the same situation as Greer, who were rooting for us because it gave them hope that they too would find their donor. And it was a beautiful thing to receive so much encouragement from other people going through the same circumstances. And just to know that their miracle is going to be out there, and we feel it for them. So I thank you for including me in this process.
Donna, thanks so much for sharing your story. As a reminder, anyone who's watching, if you have questions, please add them to the Q&A in the chat, and Terry is going to help facilitate that at the end. I believe it's my turn now. If I can see the slides, please. Thank you so much. So again, this is the inaugural webinar in this Engage series, which is a series of virtual education and engagement events for the living kidney donor and transplant community. And again, we are very grateful to Sanofi for making these webinars possible. Next slide, please. So this is a photo of my husband and I, and I will go into more detail, but obviously we're here all to learn how to help your recipient find a kidney if you can't donate. Next slide, please. So we found out by accident in 2001, my husband was undergoing another medical screening, and we found out by accident that he has polycystic kidney disease. that was a blessing and a curse. We found out so early, but as anyone in this space knows, you cannot do anything in terms of helping the person who needs a kidney until they're in kidney failure. So for 15 years, we waited and watched him deteriorate. We watched his kidney function go down. However, we did have excellent support from his brother. He and his brother look like twins. They're not actually. His brother lives in South Africa. My husband's from South Africa. So it was no small feat for his brother to come to the States twice to do all the medical testing. But he assured us from the very beginning, it was very, very supportive, saying, you know, it's not his kidney. He would give it to Neil, and that would be that. And much to our disappointment, he was not approved to donate due to a minor heart condition. So that was a huge, huge setback for us. But I am young and healthy, and I thought, well, I'm going to do this for my husband. They took one look at me and the size of Neil. They already talked to us about doing a paired exchange. They said I was too small for my kidney to go into Neil to sustain him. However, I was also medically disqualified. So then we have a big problem. I like to say that we had all the ingredients for failure in terms of a good outcome. Neil did not want to tell anyone. He was very private. He would not, and I find this a lot of recipients don't want to tell anyone. They don't want to burden other people. We had exhausted everything within our family, and everyone who was willing and or able was ineligible. And then when we ultimately did find an approved donor, they were not compatible with Neil. They were not a match. And I'll go into that a little bit later. You don't have to be a match to help your intended recipient, but they were not compatible with him. Next slide, please. So now what? Big problem. What I learned is a willing donor is not an approved donor. So if someone says they're going to donate, of course, we're very, very grateful that they step forward and that they are trying, but that is in no way, shape, or form a guarantee that they will actually be able to proceed with donation, as Tammy and Donna have already shared with us. The recipient needs a champion or a case manager or a donor navigator to help look for a donor. The recipient in this case, in all cases when they need a kidney, they feel awful. They're very sick. They're functioning with very little kidney function. It's hard for them to get out of bed and make it through the day, let alone if they have to go on dialysis. So the burden, unfortunately, does fall on either the recipient and or a recipient's champion who can assist with sharing their story. I do advise people to share your story anywhere, everywhere. We did not have the good fortune of having a microsite. I didn't even know that those were available back in 2017. So I spoke at local community events, and we put flyers in coffee shops. We did sort of grassroots method, but however you can do it, like the t-shirts, the magnet that Donna showed, just get it out there. The process will take longer than you think. Anyone who's ever tried to go through living kidney donor evaluation knows that it's the best physical you'll ever have in your entire life. And it takes a long time for someone to get worked through the process. And then, like I was, only denied at the very, very end. I passed every other screening, and then at the very end, I was not eligible to donate. There was nothing I could do about that. So fortunately, we had started his process very early. I started researching transplant centers when he was between 20 and 25 GFR. So that did give us a little bit of extra breathing room at the end. We were very grateful for that. And also, do not stop sharing your campaign until a kidney has been transplanted into your recipient. My husband, who of course didn't want anyone to know, had people reach out to him. Oh, Neil, I keep seeing the posts. I keep seeing the posts. Are you okay? He's like, yeah, I've got people come forward. And I was like, Neil, no, you cannot say that. We don't want to stop sharing our message until he has been transplanted. You have to keep going until he's in post-op. Next slide, please. So as I said, I shared our story locally among our community. It was also like Tammy, it was my first time ever venturing into social media. I didn't have an account. I didn't need an account, but when I needed a kidney, I had to look into that. I shared it with two teachers at the school where I worked. Allison is on the left and Brittany is on the right. they both wanted to donate, although Brittany kept it a secret from us the entire time. Allison's husband had donated previously about 10 years prior, so she knew the process. She wanted to do it as soon as she heard Neil's story. Brittany kept it quiet from us because she didn't want us to be disappointed if yet another donor was not approved. In the end, they were both approved donors. So I like to say we found not one, but two, which is very rare. And they both of their priorities were to save Neil, help Neil. So they both were entered into the National Kidney Registry. Neither of them were compatible with Neil. They were both entered into National Kidney Registry on his behalf. Brittany's a universal donor with blood type O, so she matched first. So she and Neil did a paired exchange in September of 2017. And her chain was 4 long, and 2 months later, Allison did another paired exchange, and her donation chain was 4. So across the United States, 8 lives were saved because one man needed a kidney. So you never know the other people that you're going to impact just by coming forward. Next slide, please. So boy, in sickness and in health really hit home when we were going through this. And I like to say the best gift I've never laid eyes on keeps my husband alive. And it has infused our family with invigorating vitality and renewed appreciation. Keep in mind, you are not just saving or helping the recipient, you're helping the entire family. Next slide, please. So we did find out who Neil's donor was. He had tried to reach out to her through the transplant center coordinators twice. He didn't hear anything, and we understand people want privacy. Sometimes they don't want to interact at all. We respect that. We understand. However, he just felt this tug, thinking, I'm just going to reach out one more time. So he reached out. This would be his 3rd time reaching out, and this was the first time that Shannon, his actual donor, received the message. So this is just a message to remind you that sometimes wires can get crossed, balls can get dropped, things don't always happen the way they're supposed to. So we are very grateful that he reached out that 3rd time, which for her was the first time she ever received the message from him. She reached out immediately. So we got to know her. He and Shannon and Neil were able to meet. She lives in Los Angeles. They were able to meet on one of his business trip layovers. And I started following her on Facebook because I was new to Facebook, and I was following this person that gave her kidney to my husband. So we found out she was a runner. I am not a runner at all. I had started walking because I was so stressed out during this entire process. And then I thought, well, I would like to do something to honor her. I thought I'd fly out to California, do a 5K, something like that. Well, my 12-year-old daughter said, Mom, that's ridiculous. That's pathetic. She gave Daddy a kidney. You've got to do more than a 5K. So I took a huge leap of faith. Shannon and I planned it for 6 or 7 months in advance. We agreed to do the Golden Gate Half Marathon together, and I met her 14 hours before we crossed the finish line together. And the story goes, as my husband likes to say, which is actually true, Neil getting a kidney is science. His wife running a half marathon is nothing short of a miracle, because that's true. So next slide, please. This whole process was really hit home for me, and it changed my life tremendously. I was working in a school. Now I'm fortunate to work in this living kidney donation space. And I worked really hard to share our story in mainstream media, not because it's about us, but because there are other people in our situation, and I want them to know that there is hope, that there is a way forward. So one of the things that I wrote, I did a lot of journaling and writing during this whole process, which helped a lot. We may not realize it when we hit rock bottom, but our darkest days can be a gift to others. Our story of survival could be another family's beacon of light, and that is why I share. And regarding my husband's reluctance to share in the beginning, after he got the kidney, he was like, okay, good. I'm going to go back into my privacy world. We don't have to talk about me anymore. I'm good. I got the kidney. I said, no way. We're going to help other people now. And at first he was very reluctant to do that. And then he finally said, which I just think is a beautiful statement. He said, my privacy is not worth another person's life. And now he is very vocal about sharing other people's journeys, and he encourages them. He says, don't be like me. Let everyone hear your story, because that's the right thing to do. Next slide, please. So this is just a visual of how you can share your kidney campaign if you don't have access to a microsite, which is what we did not have access to. You don't have to do a fancy website. You don't have to have anything technical. You can put it on a t-shirt. You can put it on your car. You can wear a sign around town. Anything and everything that you can do to get the word out is the best thing to do. As Tammy and Donna shared, only takes one person. You just need the right person to see it at the right time. Next slide, please. So this is, we were actually at a National Kidney Registry Center. Thank goodness he was transplanted at Johns Hopkins Hospital. And prior to going into this, I didn't know anything about parent exchange. I didn't know anything about National Kidney Registry. We were green. We knew nothing. And because of my work and because of things that I have learned, I did learn that you can use a microsite as Tammy and Donna used. It is a great way to get your story out, but it doesn't have to be the only way. If you are at a National Kidney Registry Center, or if your recipient is, and you have access to a microsite, I do encourage you to take advantage of that. Next slide, please. So this is something that I drew up after we found the kidney and after we had sort of finished the process, although for me it was just beginning. I felt like I had to be a warrior during this whole process. You have to have courage. You have to be brave. You have to be resilient. It is hard work to keep sharing the story, not knowing if or when the right person will see it. So I just came up with this this mantra, be fierce in your search for a living donor. It basically just summarizes the lessons that we learned. Finding a kidney begins at the end of your comfort zone. My husband did not want to tell a soul. So I had to force him to get out of his comfort zone. Not only for him, but for me, it was hard to get out there and tell the world we needed an organ. I put it on Facebook. It's kind of humbling and vulnerable, but it's still the right thing to do. So that goes into the next one. Invest in your future and forsake privacy. Privacy gets to the trunk. Privacy does not sit in shotgun for this journey. Early exploration allows you to adjust your compass for any transplant journey. Like I said, I'm very, very fortunate that we started the process early because we did have setbacks. His brother and I were both denied, and we had a total of 27 candidates who came forward, and of those, 7 were denied. So it was not as straightforward as we thought it would be. Again, getting back to the tell your story, I like to just say raise awareness and humanity will rise to the occasion. One person, it just takes one person. You just have to share it. Courageous conversations can save a life. And this was daunting for me. It was hard for me to get up in local community groups, to put it on Facebook, to share it. And this is just me. I'm the person sharing the message. So it requires courage on both the part of the recipient and the champion who is helping the recipient. And really the biggest aspect of our journey, which I think helped us so much, is education. We learned everything and anything we could about the process, about donation, about how to find a donor, about what makes someone ineligible. Of course, all the while leaning on medical professionals for medical advice. But I like to say, educate yourself. Knowledge will be your strongest ally throughout the whole procedure. Next slide. And again, this is getting back to where I said I'd like to share our story in mainstream media. And it's because even though our story is about our family, it's not really about us. It's about the 100,000 other people in this country who are waiting for a kidney. I will never be able to donate my kidney, but I have vowed to donate my voice to this cause. My husband's so sick of hearing that. Next slide. And now we're going to open it up for questions after next slide, please. We just want to show again that we are grateful to be able to host these webinars, thanks in large part to Sanofi. Now I'm going to turn it over to Terry, the Vice President of National Kidney Donation Organization, also a non-directed donor, and she's going to guide us through some Q&A. Thanks,
Right,
Terry.
thank you. Thank you all for sharing your stories. There was a lot of feedback in the Q&A and chat about the inspiration that you all provided. So I do want to start on a light note. There is someone who is attending the webinar who she matched with her recipient through Match.com. She said they were not a romantic match, but they ended up becoming great friends. And when he needed a kidney, she stepped up. So I thought that one was a really great story. We've had a couple people ask questions about microsites and also point out the need that you do not need to match your intended recipient. So the idea of, wearing t-shirts that say a blood type needed, I need a kidney. I would suggest that you don't limit yourself that way. If you're working through a center that works with one of the large paired kidney donation organizations, one's the National Kidney Registry, there are others. You don't need a direct blood type match. So never limit yourself, I would say, early in the process by saying that, because there are options of paired exchange, voucher donations, which is basically you donate to someone who matches you so that your person gets the match they need. So I never look at it as donating to someone. You're donating to or for someone. And both of those are equally powerful. In fact, donating for someone through a paired exchange or a voucher, you're actually helping more people. So I would suggest that you not limit yourself in the way that you approach the need for a donor. There were some questions about microsites. Lisa did weave that in after that question was asked, but microsites are a tool offered at most of the National Kidney Registry centers. There is a chart. I put the link in the chat window for you to be able to check to see if the center where your recipient is offers microsite. So, there's no harm in having a website and a microsite, but that microsite team at the NKR has a coach that will help get you some free business cards, get that free website set up so that you can start sharing that link. Our person from Match.com did say, we met on Match.com years before the kidney issue. Match.com gets very nervous about people meeting to get an organ. That makes good sense. So it was a long-term story, but it is an interesting origin story nonetheless. One question that came in that would be great for Lisa, Tammy, and Donna to address is, how did you respond when people asked why you weren't donating? Donna, do you want to go first?
I think that was a huge concern for me, is when here I am completely publicizing it to anyone and anyone who would listen or read that my son needed a kidney. And I could think in my head, they must be saying, you're his mother, why aren't you doing it? So in the majority of my posts on social media, I would state right away that I was disqualified, medically disqualified, as was my husband and my other son. So I didn't get into all the details, but I said we were medically disqualified. And that sort of kind of covered a lot of bases in terms of people wondering why I wasn't the one doing it, since I was his mother. So it is not everybody does do that, but I felt more comfortable putting that out there, that I was automatically disqualified through my own testing.
Great. Thank you, Donna. Tammy, how would you respond?
I did the same thing, just said that I was medically ineligible, as was my husband. I think probably the hardest part of the journey was that it felt like forever for us to go through our testing. And so during those few months, we were still in parallel asking people to please consider being tested, while at the same time we hadn't been ruled out, nor had we been approved. And so during those months, we would just say, we're going through the process, but it's not likely that we're going to be approved to donate. We would kind of answer it that way. And then once we were unfortunately declared ineligible, which was probably like one of the hardest parts of the entire journey, was hearing that nope, not going to be you. um, then I did start to do as Donna did in each of the posts and anything that, anytime I was talking about it, just to say that unfortunately we were medically ineligible, which, puts us in a very vulnerable spot that we need to rely on other people to save our kid.
Yeah, thank you, Tammy. Lisa, what about you?
I would also respond the same way. The very first thing that I used in my spiel when I was sharing the message was that all willing and interested family members had already been medically disqualified. I, as Dr. Leonberg, you shared and had encouraged, fortunately, my situation, the reason I was denied is because of a condition in my renal arteries that will not ever allow me to donate. The team did make me aware of it and said it can impact other areas of the body. So I went and followed up with my primary care, and I had the screenings that were recommended. Fortunately, this is a non-event for me. It just is a big event because I was trying to donate a kidney. But for the rest of my life, the way I live my life, I'm healthy and I don't have to worry about the renal condition that they uncovered. But that is a big part of the story that I shared so that people wouldn't be looking, well, why aren't you? Why, what's, and one of the other things that I see in a lot of campaigns online is the recipient, smiling with all these big family members. There's like a huge family around them. And the automatic assumption is, well, if they're out here asking for a kidney, what about all those people? So it is a question that people ask. And so I do feel it is very important to address it, because if you're out there asking a stranger to do something this significant for a loved one, they need to know that you were just as willing to do it. You're just not able.
Okay, we do have a follow-up to that in the question and answer window is, what if there is a situation where someone might be eligible to donate and they just choose not to for that family member or friend? How would they respond, or how might the family respond to that situation? That's a tough one. I mean, you all were medically ineligible, so it's a little bit different, but any suggestions?
Yeah, I was going to say, I typically, because I think that there are a lot of people in that situation. And in all of my posts, I would include in the post something along the lines of, donation is not for everyone or for everyone in every season of their lives. And so if this is not your season for donating, please consider sharing the story, because it could just be any number of reasons why today is not a good day. 5 years from now might be a good day. But it doesn't mean that they are never going to donate or never want to donate. So that's sort of how the other thing too is I wanted to mention that going through the process allows me to have an understanding for what potential donors would go through, so that I could speak, as Lisa was saying, you want to have as much knowledge as possible. And it did give me that background to know, like, oh, okay, this is how the process goes and this is what they would be going through.
Right. One final thing, and this will be the final question, and it's the last one we had in the chat window, was the idea of considering another center if you were medically ruled out at one. Somebody asked a very specific question about a condition in the Q&A, which we can't address the medical issues, but it did raise the good point that there are some things, like Dr. Leonberg, you shared, are automatic rule outs. No center is going to take someone with certain conditions, but there are centers that have different levels of risk acceptance over others, whether it's the background of the surgeon, whether it's the experiences of the individual team members, but one BMI that might rule you out at one center might not be ruled out at another. So I'm not suggesting that you asked to be evaluated at every center in the US. I think after a couple, you're going to have a really good feel for that. But we have encountered situations where a donor candidate is ruled out at one center and accepted at another. So if you have that geographical luxury, it might be worth just asking the question, especially if your center said, you're so close, or, you might, a center might even suggest that you get evaluated at another center. Do that. I mean, I would definitely try and do that. We had someone who just said she found it difficult to get listed at multiple places. I was listed at one. I'm not sure if that's as a recipient. I do know that there are some constraints about how many centers that you can be listed at. For a donor, if you're part, especially of a wider network of hospitals, you really only need to be listed, at one to make your donation matter. We do have access to a program as well, and we could follow up and put this in the follow-up email. If you have been ruled out because of BMI or the need to quit smoking, there are free support services available that the National Kidney Donation Organization partners with through the University of Chicago to provide you with free weight loss support. It supports the donor candidate up to the point of donation as well as 1 year post. I'm going to go ahead and put a link to them in our chat window. And then that is our last question. So I'm going to turn it over to Lisa. The name of the organization is Project Donor. So if you don't catch it out of the chat window, I encourage you to look at what Project Donor has to offer. They've put, I think they're probably over 30 donor candidates that they've gotten ready for donation who've gone on to donate because of their services. That's all.
Thank you. So I'm going to wrap up. I want to extend a huge heartfelt thanks to Dr. Leonberg, you, Tammy, and Donna for sharing your stories. I know that there was a lot of heartache in your story when you were not able to donate, and I am very glad to know that you were able to overcome it, and hopefully this webinar will inspire others. So thank you. Terry, thank you for doing the Q&A. Thank you to anyone in our audience who gave us an hour of their day to watch and learn. Again, this series would not be possible without a generous sponsorship from Sanofi. So again, we want to thank them for making this educational series available. You will be receiving a survey and a follow-up email. I do encourage you, I know nobody likes surveys. I do encourage you to fill it out. It will not take long at all. It will help us to learn how to better serve you in terms of other educational events that we will be offering. If you don't follow National Kidney Donation Organization on social media, I encourage you to do so. Our main platforms are on Facebook and Instagram. And last but not least, if you are not a member of the National Kidney Donation Organization, I do encourage you to join. We're not going to spam your inbox. We're not going to come to your door and knock on your door and talk to you about kidney donation. We will keep you apprised of industry events happening both virtually and in person, such as this. So if you're on our mailing list, you will receive future emails about other events of this sort that we will be having. And
I did just put the link to the survey in the chat window. I can't put it in the question and answer. So you will get it in a separate link, but the sooner you respond, it'll be all over and it'll mean a lot to us. So thank you.
And Terry or Lisa, how would people become members if they wanted to become members of NKDO?
So on our website, nkdo.org, there is a button up at the top that says membership. Thank you, Tammy, for pointing that out. So you click on membership and you can go from there. It's pretty easy, self-explanatory. Again, you don't have to be a donor. You don't have to be a recipient. You just have to be involved in the kidney donation space and wanting to help others. So with that, I want to honor everyone's time. And I think we are right at our 1 hour mark. So thank you all for joining us, and everyone have a great afternoon. Thank you.